Knee pain is one of the most common complaints among people over 60, and if you're nodding in agreement, you're certainly not alone. Whether it's due to arthritis, aging joints, or years of wear and tear, sore and stiff knees can make even the simplest daily activities feel like a chore. Climbing stairs, getting out of a chair, or even walking across the room might be more difficult than it used to be. And unfortunately, ignoring knee pain can often make things worse over time. But here's something most people don't realize. The right kind of movement can be one of the best remedies for chronic knee pain. You don't need fancy equipment, expensive physical therapy sessions, or painful procedures. In fact, just a few minutes of targeted knee strengthening exercises each day can help reduce pain, improve joint function, and even prevent future injuries. The key is to strengthen the muscles that support your knees, especially the quadriceps, hamstrings, calves, and the stabilizing muscles around the hips. When these muscles are strong, they take pressure off the knee joint, making movement smoother and less painful. In this video, we're going to walk you through a series of simple, gentle, knee-strengthening exercises that are perfect for seniors. They're low impact, easy to do at home, and designed specifically to bring relief without straining your joints. Whether you're living with arthritis, recovering from an old injury, or just trying to stay active and mobile, these moves can help you regain control, one step at a time. Stick with us to the end, because we'll also share daily tips to protect your knees long-term and help you move more freely well into your golden years. Exercise 1. Seated leg extension. Let's start with one of the most beginner-friendly and effective exercises for strengthening the knees. Seated leg extensions. This exercise focuses on your quadriceps, the large muscles at the front of your thighs that are essential for knee support and stability. Strong quads can significantly reduce pressure on your knee joints and make everyday movements like standing, walking, and climbing stairs much easier. How to do it? Sit upright in a sturdy chair with your back straight and both feet flat on the floor. Place your hands on the sides of the chair for support. Slowly extend your right leg forward until it's as straight as you can comfortably make it, with your toes pointing toward the ceiling. Hold the position for 3 to 5 seconds, focusing on tightening the muscles at the front of your thigh. Slowly lower your leg back down to the floor. Repeat the same movement with your left leg. Aim for 10 to 15 repetitions on each leg and try to complete 2 to 3 sets per day. Rest briefly between sets if needed. Tips for success. Move slowly and with control. Rushing can reduce the effectiveness and strain your joints. If you're feeling strong, add light ankle weights for extra resistance, but only after getting comfortable with the basic movement. If you experience any sharp or shooting pain, stop the exercise and consult with a healthcare provider. Why it works. This exercise isolates the quadriceps without placing your full body weight on the knees, making it ideal for seniors with knee pain or limited mobility. Over time, consistent practice of seated leg extensions can help stabilize your knees, reduce discomfort, and make daily tasks easier. Exercise 2. Straight leg raise. The straight leg raise is a classic and powerful move that targets both your quadriceps and hip flexors, helping to strengthen the muscles that support your knees from above. This exercise is especially helpful if you're dealing with knee pain caused by arthritis or previous injuries, as it builds strength without putting stress on the joint itself. How to do it. Lie flat on your back on a yoga mat, bed, or soft carpet. Keep one leg bent with the foot flat on the floor and the other leg straight. Tighten the muscles in the straight leg, especially the thigh, and slowly raise it to about the same height as the bent knee. Hold the position for 3 to 5 seconds, keeping your leg as straight as possible. Slowly lower it back down with control. Repeat for 10 to 15 repetitions, then switch legs. Aim for 2 to 3 sets per leg, resting briefly between sets. Tips for success. Keep your abdominal muscles slightly engaged to protect your lower back. Avoid arching your back or letting your leg drop too quickly. If the movement is too difficult at first, try raising your leg only part way until you build strength. Why it works. The straight leg raise is a low-impact exercise that strengthens the muscles around your knees, hips, and core without any bending or pressure on the knee joint itself. This makes it ideal for seniors who are trying to improve leg strength while managing chronic knee conditions or limited mobility. With consistent practice, you'll notice improved stability when walking or standing, and a gradual reduction in knee discomfort, especially when rising from a seated position or climbing stairs. Exercise 3. Wall sit modified for seniors. The wall sit, especially in its modified form, is a fantastic way to build endurance and strength in your thighs, hips, glutes, and calves without requiring fast movements or complex coordination. It strengthens the entire lower body while training the muscles that stabilize and protect your knees, making it especially effective for seniors managing knee pain. How to do it. Stand with your back flat against a wall, feet shoulder width apart and about 1 to 2 feet away from the wall. Slowly slide your back down the wall, bending your knees slightly. Only go as far as you feel comfortable, ideally around a 45-degree angle, not a deep squat. Hold this position for 10 to 30 seconds, keeping your abdominal muscles engaged and your back supported by the wall. Slowly rise back up to a standing position. Rest, then repeat 2 to 3 times. As your strength improves, gradually increase the hold time by 5 to 10 seconds each week. Tips for success. Don't let your knees go past your toes. Adjust your foot position if needed. Keep your knees aligned with your ankles and avoid letting them collapse inward. You can place a stability ball or a small pillow behind your back for extra support if needed. Why it works. Modified wall sits activate all the major muscles that support the knee joint, especially the quadriceps and gluteal muscles. This helps offload pressure from the knees during walking, standing, and stair climbing. Because you're holding a stationary position, there's no impact, just gentle, controlled strengthening. Wall sits are a simple, powerful way to train your lower body and reduce daily knee strain. Stick with it, and you'll likely notice improved stamina, balance, and joint comfort within weeks. Exercise 4. Step-ups, using a low step or stair. Step-ups mimic a natural movement we use every day, climbing stairs. By practicing controlled step-ups on a low platform, you strengthen the quadriceps, hamstrings, glutes, and calves, which all play a key role in knee stability and mobility. This exercise also improves balance, coordination, and confidence, especially for seniors who may feel unsteady on their feet. How to do it. Stand in front of a low, sturdy step or bottom stair, ideally 4 to 6 inches high. Place your right foot firmly on the step and slowly press down through your heel to lift your body upward. Bring your left foot up to meet the right on the step. Pause briefly at the top, then carefully step back down with the left foot, followed by the right. Repeat the motion 10 times with the right leg leading, then switch and lead with the left for another 10 repetitions. Complete 2 sets per leg, resting as needed between sets. Tips for success. Use a wall, railing, or chair nearby for support and balance, especially when starting out. Avoid pushing off too forcefully. This should be a slow, controlled movement. Focus on keeping your knee aligned over your ankle throughout the step. Why it works. Step-ups are a functional strength exercise, meaning they train your body to perform everyday tasks more efficiently and safely. They help strengthen the muscles that cushion and support the knees, making walking and stair climbing less painful. Over time, this move can also reduce your risk of falls by improving your sense of balance and lower body control. Even if you only use one step, doing this daily can make a dramatic difference in your mobility and pain levels. Exercise 5. Standing hamstring curls. While many exercises focus on the front of the thigh, the hamstrings, the muscles located at the back of the thigh, are just as important for knee health. Standing hamstring curls strengthen these supportive muscles, helping to stabilize the knee joint and reduce stress on the kneecap during walking, bending, and lifting. This exercise is gentle, low impact, and perfect for seniors looking to restore leg strength and ease knee pain without needing to get down on the floor. How to do it. Stand behind a sturdy chair or hold onto a countertop for balance. Slowly bend your right knee, lifting your foot behind you toward your buttocks. Try to keep your thighs aligned and your back straight. Lift your foot as high as you comfortably can. Aim for a 90-degree angle, but it's okay if you can't reach that height at first. Hold the position for 3 to 5 seconds, feeling the squeeze in the back of your thigh. Lower your foot back down with control. Repeat 10 to 15 times on the right leg, then switch to the left. Aim for 2 sets per leg, adding more repetitions as your strength improves. Tips for success. Keep your movement slow and steady. No swinging or jerking. Avoid arching your back or shifting your weight side to side. If needed, wear ankle weights for added resistance after mastering the basic motion. Why it works. The hamstrings play a key role in bending the knee and stabilizing the joint during movement. Weak hamstrings can lead to knee imbalances and increase your risk of injury. This simple exercise strengthens the back of the leg while also gently activating your core and improving posture, all without straining your knees. When done regularly, standing hamstring curls can reduce stiffness, improve walking endurance, and support overall knee comfort. Exercise 6. Calf raises for lower leg support. When it comes to relieving knee pain, the calves are often overlooked, but they're vital to proper leg alignment and shock absorption during movement. Strong calves help stabilize your ankles and knees, reduce joint strain, and improve your overall balance and walking gait. Calf raises are a simple but highly effective way to build this often neglected strength. How to do it. Stand upright behind a sturdy chair or counter for support. Keep your feet hip-width apart and your body aligned. Slowly lift both heels off the floor, rising onto the balls of your feet. Hold the elevated position for 2 to 3 seconds, engaging your calves and core. Gently lower your heels back to the floor. Repeat 10 to 15 times, aiming for 2 to 3 sets. As you gain confidence, try the movement without holding on. This will challenge your balance and strengthen your stabilizer muscles even more. Tips for success. Keep your movement smooth and controlled. Avoid bouncing. Make sure your weight stays centered over your feet. Don't lean forward or backward. Maintain an upright posture. Why it works. Strong calves absorb much of the impact your legs experience when walking or standing. By building strength in these muscles, you reduce the workload on your knees and improve the overall function of your lower body. Calf raises are also excellent for enhancing balance, a critical skill for seniors who want to prevent falls. Best of all, this exercise is easy to do anywhere, even while brushing your teeth or waiting for the kettle to boil. Tips and lifestyle advice for long-term knee health. Exercise is powerful, but it's just one piece of the puzzle when it comes to managing knee pain after 60. To truly protect your knees and support long-term mobility, it's important to adopt a few smart lifestyle habits that work alongside your strengthening routine. These small changes can make a big difference in reducing inflammation, preventing injury, and keeping you active well into your later years. 1. Maintain a healthy weight. Every extra pound you carry adds pressure to your knees. In fact, research shows that for every pound of weight gained, your knees feel 4 additional pounds of pressure. By staying within a healthy weight range, you can significantly reduce wear and tear on your joints and ease chronic pain. Even losing just 5 to 10 pounds can lead to noticeable relief. 2. Stay hydrated. Your joints need lubrication to function smoothly, and that means drinking enough water. Staying hydrated helps your body maintain the synovial fluid that cushions your knees. Aim for 6 to 8 cups of water per day, and more if you're physically active. 3. Warm up and cool down. Never skip your warm-up or cool down. Gentle stretches and slow walking before and after your exercise routine help prepare your muscles and prevent injury. Stretching also improves flexibility and keeps the tissues around your knees supple. 4. Use supportive footwear. Worn out or unsupportive shoes can throw off your alignment and strain your knees. Invest in shoes with good arch support, shock absorption, and a comfortable fit. For added protection, consider using orthotic inserts designed to reduce pressure on your joints. Apply hot or cold therapy. If your knees are sore after exercise, applying an ice pack for 15 to 20 minutes can reduce inflammation. On stiff mornings, A warm compress or heating pad can loosen up your joints and make movement easier. 6. Consider anti-inflammatory foods. Incorporating foods like salmon, turmeric, leafy greens, berries, olive oil, and nuts can help combat inflammation from the inside out. These nutrients not only support joint health, but also promote overall well-being. 7. Rest when needed. But don't stop moving. While rest is important, too much inactivity can actually stiffen your joints. Aim for gentle daily movement, even short walks or light housework, to keep circulation flowing and your joints engaged. Just remember to listen to your body and take breaks when needed. Your knees carry you through life. Every step, every stride, every moment of movement depends on them. And while aging naturally brings some changes to our joints, knee pain doesn't have to be the end of your independence or activity. As you've just seen, a few minutes of gentle, focused movement each day can make a profound difference. By practicing these knee-strengthening exercises consistently, you're not just reducing pain, you're rebuilding strength, improving balance, and taking control of your health. Remember, progress doesn't happen overnight, but with time, these simple routines can restore confidence in your movements and comfort in your daily life. It's never too late to start caring for your body in a new way. The key is consistency. Even 10 minutes a day can create lasting improvements. Pair these exercises with the lifestyle tips we discussed, and your knees will thank you in the months and years ahead. And if you found this video helpful, don't keep it to yourself. Share it with a friend or loved one who might be struggling with knee pain. Sometimes a little encouragement and the right information can spark a major positive change. Don't forget to hit the like button if this video helped you. Subscribe to our channel, Elderly and Wise, for more senior-focused health tips, exercises, and wellness advice. And leave a comment below. We'd love to hear which exercise helped you most or what topics you'd like us to cover next. Stay strong, stay mobile, and stay wise. You've got this.